This is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. We are going to be talking about tolerance today in addiction and in pain patients. Tolerance is an issue that people ignorant of addiction and pain treatment have glommed onto as a pathway to addiction. We know that addiction is triggered genetically. There's no pathway. The old saw about 80% of heroin addicts had a prescription at one time for opiates. People that are grossly overweight had been down to the donut store. It's got to start somewhere. That's a very ignorant statement to make. This old gateway stuff about marijuana and everything leading to heroin, no. That's why there's a new understanding that we're trying to get across. It's an addictive disease. It's caused by addiction, caused by genetics. It's different than all the other addictions. They are dependent on substance, but not this one. So what happens is that the zealots and the people of ignorance, moving in the darkness of ignorance, say, wait a minute now, if you become tolerant, then you have to escalate the dose. And if you escalate the dose and you're on too long, you're going to become addicted. Because we've done all this research that shows that the longer you take the drug, the more chances are you're going to get addicted. True, but not for opiate addiction. Opiate or heroin addiction is different. Tolerance develops in everybody who takes pain medicine, whether you're a heroin addict or a pain patient. And the FDA has said this is to be expected. So 70% of people, according to our latest poll, have developed tolerance during their time. So what you do, you just increase the dose. If you keep increasing the dose and it doesn't work, you rotate out to another medicine. It's a normal and expected thing. If you have heroin addiction, it happens the same way. Heroin is a pain pill and a powdered pain medicine that's shot intravenously. But it's still an opiate. And so tolerance develops, and that's why people with heroin disease want to get more. Not because of the euphoria, which is certainly one reason, but they start to withdraw. When you're on IV drugs, you start to withdraw before the next drug is due. Most people who are taking opiates at home, if they skip a couple doses, pain may be starting, but you don't go into withdrawal. So both diseases involve tolerance. But tolerance amongst everybody taking pain medicine is not an issue. We just saw something from our old friends at PROP. Do you remember them? The Physicians for Responsible Opioid Prescribing, PROP. They didn't like the letter from the AMA to the CDC claiming that they're being derelict and there's just going to be more addiction. And what they said was real key. They said to the AMA, you are not paying enough attention to dependency and addiction. See how they linked them together? Okay, dependency we've talked about before is the physical interaction with the medicine, and it occurs tons of times in many other medications. We have a list of about 15 different medications that you have this interaction so that when you stop, you have some kinds of reactions to it. That's got nothing to do with addiction. So addiction and tolerance in pain patients, which is 10 million people, have nothing to do with addiction, 1 million people. So anybody saying that dependence and addiction should be monitored is got the wrong information and is ignorant. Ignorant means people that don't have the facts. I'm ignorant about a lot of things. But this group, PROP, P-R-O-P, is taking a stance that really is starting to look very extreme and seems to involve a lack of knowledge about the basic science. Dependency and tolerance have nothing to do with addiction. Thank you.